Hi everybody, this video of mine is about chickenpox, which is a very common illness. This is an infection caused by varicella zoster virus. It causes an itchy rash with small fluid-filled blisters. This is highly contagious to people who have not taken vaccine before or who have never had this disease before. Nowadays, a vaccine is available that protects children against chickenpox. Routine vaccination is recommended by Centers of Disease Control and Prevention, that is CDC. The chickenpox vaccine is a safe, effective way to prevent chickenpox and its possible complications. Now let me tell you the symptoms. The itchy blisters rash caused by chickenpox infection appears 10 to 21 days after exposure to the virus and usually lasts about 5 to 10 days. Other signs and symptoms which may appear 1 to 2 days before the rash include fever, loss of appetite, headache, tiredness, and a general feeling of being unwell, that is known as malaise in our medical terminology. Once the chickenpox rash appears, it goes through 3 phases. This is an important thing to remember. The first phase is raised pink or red bumps, which are known as papules, which break out over several days. The second stage is small fluid-filled blisters, which are known as vesicles, which form in about 1 day and then break and leak. The third stage is formation of crusts and scabs, which cover the broken blister and take several more days to heal. New bumps continue to appear for several days, so you may have all 3 stages of the rash: bumps, blisters, and scab lesion at the same time. You can spread the virus to other people for up to 48 hours before the rash appears, and the virus remains contagious until all broken blisters have crusted over. The disease is generally mild in healthy children. In severe cases, the rash can cover the entire body, and lesions may form in the throat, eyes, and mucous membranes of the urethra, anus, and vagina. If you think you or your child might have chickenpox, you should consult your doctor. He or she usually can diagnose chickenpox by examining the rash and considering other symptoms. Your doctor can also prescribe medication to lessen the severity of chickenpox and treat complications if necessary. To avoid infecting others in the waiting room, call ahead for an appointment and mention that you think you or your child may have chickenpox. Also, let your doctor know if the rash spreads to one or both eyes, the rash gets very red, warm, or tender. This could indicate a secondary bacterial skin infection. Or if the rash is accompanied by dizziness, disorientation, rapid heartbeat, shortness of breath, tremors, loss of muscle coordination, worsening cough, vomiting, stiff neck, or a fever higher than 102 degrees Fahrenheit. Anyone in the household has a problem with our immune system or is younger than 6 months, then in that case also you should inform doctor. Now let me tell you the causes. Chickenpox infection is caused by virus. It can spread through direct contact with the rash. It can also spread when a person with the chickenpox coughs or sneezes and you inhale the air droplets. Now coming to the risk factors. Your risk of becoming infected with the varicella zoster virus that causes chickenpox is higher if you haven't already had chickenpox or if you haven't had the chickenpox vaccine. It is especially important for people who work in childcare or school settings to be vaccinated. Most people who have had chickenpox or have been vaccinated against chickenpox are immune to chickenpox. If you have been vaccinated and still get chickenpox, symptoms are often milder, with fewer blisters and mild or no fever. A few people can get chickenpox more than once, but this is very rare. Coming to the complications. Chickenpox is normally a mild disease, but it can be serious and can lead to complications including bacterial infection of the skin, soft tissues, bones, joints, or bloodstream, dehydration, pneumonia, inflammation of the brain, that is known as encephalitis. It can also lead to toxic shock syndrome, which is a dangerous condition. A dangerous syndrome, which is known as Reye syndrome in children and teenagers who take aspirin during chickenpox. So this is a very important thing to remember. Also, if it is too much serious, then death can take place. People who are at high risk of chickenpox complications include newborns and infants whose mothers never had chickenpox or the vaccine, adolescents and adults, pregnant women who haven't had chickenpox, people who smoke, people whose immune system are weakened by medications such as chemotherapy or by a disease such as cancer or HIV, people who are taking steroid medication for another disease or condition such as asthma. So these people are more at risk. I want to tell you about chickenpox and pregnancy also. Low birth weight and limb abnormalities are more common among babies born to women who are infected with chickenpox early in their pregnancy. When a mother is infected with chickenpox in the week before birth or within a couple of days after giving birth, her baby has a higher risk of developing a serious life-threatening infection. If you are pregnant and not immune to chickenpox, you should talk to your doctor about the risks to you and your unborn child. If you another thing complication is shingles. If you have had chickenpox, you are at risk of complication called shingle. This varicella zoster virus remains in your nerve cell after the skin infection has healed. Many years later, the virus can reactivate and resurface as shingles. I will make a separate video about shingles very soon, and maybe next video of mine will be about shingles. So keep watching this channel. Now let me tell you the prevention. The chickenpox vaccine is the best way to prevent chickenpox. As experts from CDC estimate that vaccine provides complete protection from the virus for nearly 98% of people who receive both of the recommended doses. When the vaccine does not provide complete protection, it significantly lessens the severity of chickenpox. The chickenpox vaccine is known as Verivax. It is recommended for young children. In the US, children receive 2 doses of the varicella vaccine, the first between ages 12 and 15 months and the second between ages 4 and 6 years, as part of the routine childhood vaccination schedule. This vaccine can be combined with the measles, mumps and rubella vaccine, but for some children between the ages of 12 and 23 months, the combination may increase the risk of fever and seizures from the vaccine. Discuss the pros and cons of combining the vaccine with your child's doctor. Children ages 7 to 12 years who haven't been vaccinated should receive 2 catch-up doses of the varicella vaccine given at least 3 months apart. Children aged 13 or older who haven't been vaccinated should also receive 2 catch-up doses of the vaccine given at least 4 weeks apart. Unvaccinated adults who have never had chickenpox or are at high risk of exposure can also receive vaccine. These include healthcare workers, teachers, childcare employees, international travelers, military personnel, adults who live with young children, and all women of childbearing age. Adults who have never had chickenpox or been vaccinated are usually received two doses of the vaccine 4 to 8 weeks apart. I mean, those adults who have never been vaccinated, or if they have never had chickenpox, they can receive 2 doses of the vaccine 4 to 8 weeks apart. If you don't remember whether you have had chickenpox or the vaccine, a blood test can determine your immunity. The chickenpox vaccine is not approved for pregnant women, people who have weakened immune system, such as those who are infected with HIV, or people who are taking immune suppressing medications. People who are allergic to gelatin or the antibiotic neomycin are also not approved for vaccination. You should talk to your doctor if you are unsure about your need for the vaccine. If you are planning on becoming pregnant, consult with your doctor to make sure you are up to date on your vaccination before conceiving a child. Now let me tell you the diagnosis and treatment. First, diagnosis. When patients come to us, we generally diagnose chickenpox based on the rash. It's very easy to diagnose, as I told you the symptoms before. But if there is any doubt about the diagnosis, chickenpox can be confirmed with lab tests, including blood test or a culture of lesion samples. Now let's tell you about the treatment. In otherwise healthy children, chickenpox typically needs no medical treatment. Your doctor may prescribe an antihistamine to relieve itching, but for the most part, the disease is allowed to run its course. For people who are at high risk of complication from chickenpox, doctors sometimes prescribe medication to shorten the length of the infection and to help reduce the risk of complication. If you or your child are at high risk of complication, your doctor may suggest an antiviral drug such as acyclovir or another drug called immunoglobulin intravenous, and that is Privigen. These medication may lessen the severity of chickenpox when given within 24 hours after the rash first appears. Also, if there are complications, your doctor will determine the appropriate treatment. He or she may prescribe antibiotic for skin infections and pneumonia, brain inflammation, and encephalitis is usually treated with antiviral drugs. Hospitalization may be necessary. Now, coming to the lifestyle and home remedies. To help ease the symptoms of an uncomplicated case of chickenpox, you should follow these measures which I am going to tell you. You should avoid scratching. Scratching can cause scarring, slow healing, and increase the risk that the sores will become infected. If your child cannot stop scratching, put gloves on his or her hands, especially at night. Trim his or her fingernails. The chickenpox rash can be very itchy and broken vesicles sometimes sting. These discomforts, along with fever, headache, and fatigue, can make anyone miserable. For relief, you can try a cool bath with added baking soda, aluminum acetate, uncooked oatmeal, or colloidal oatmeal, a finely ground oatmeal that is made for soaking. You can use calamine lotion, which is easily available without prescription. Calamine lotion dabbed on the spots. A soft, bland diet if chickenpox was developed in the mouth. Antihistamines such as diphenhydramine, coming with the name of Benadryl, for itching can be used. Check with your doctor to make sure your child can safely take antihistamines. Acetaminophen, that is Tylenol, for a mild fever can be taken. If fever lasts longer than 4 days and is higher than 102, you should call your doctor. And do not give aspirin to children and teenagers who have chickenpox because it can lead to a serious condition called Reye's syndrome. You should talk with your doctor before giving any types of non-steroidal anti-inflammatory drug such as ibuprofen to someone who has chickenpox. Some studies suggest that this type of medication may lead to skin infection or tissue damage. So I hope you like this video of mine. Till now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit to you, please like the video. That will give me encouragement to make more videos on health issues. And please do not forget to share my videos with others through social media so that more and more people can get benefit from my videos.